The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Did you have a drink of water today, buckle up, or simply grow another day older? Then you have experienced the impact of public health. Why are we now living longer and staying healthier? What does public health mean to you? Before you answer, join us today on Today's Health.
In the last 100 years, we've made enormous progress in medicine and health-related technology. But unfortunately, the world we live in now poses far more threats to our health. In the United States, 110 million people live in areas with harmful levels of air pollution. Hello, I'm Faith Daniels, and this is Today's Health. Sometimes it may seem like everything we eat, even the air we breathe, can make us sick. Today, we'll explore real solutions to the health problems we all face every day.
What comes to mind when you think of public health? I'll bet you your image is not one of safe food and drinking water, seat belts, and child safety laws. In fact, less than 1% of the population realizes that much of the reason our life expectancy now is 30 years longer than it was at the turn of the century is public health. In 1900, the average life expectancy was about 45 years old. But public health agencies waged a war against deadly diseases. Vaccines and antibiotics were found for killers like polio, pneumonia, and tuberculosis. Stringent guidelines made drinking water and food free from deadly bacteria and viruses. Seatbelt laws and other legislation to improve the safety of the general public eliminated thousands of deaths due to preventable injuries. Now, our life expectancy is 75 years or better.
Well, the key goal of public health is prolonging life and trying to assure that that prolonged life is of a higher quality. Prevention is the cornerstone of public health.
Let's dispel a myth. Public health is not a government-provided system of personal health care to just the poor and elderly. Public health impacts 100% of the population in almost every aspect of their lives. From the time you're in the womb until you reach your twilight years, public health plays a big part in preventing the injuries and illnesses that can cut your life short. With more parents getting their children immunized, old killers like polio, pertussis, and diphtheria are now at bay. But new killers have emerged. There are still very difficult challenges ahead.
The other set of challenges are the specific problems that we're facing. Some forms of cancer are preventable. Lung cancer is still a leading cause of cancer deaths. Something could be done about that. We also have the risks such as HIV and the increasing premature deaths that that's causing. Something could be done, but it's less likely to come through medical care than it is through prevention.
The reason so few people understand the term public health could be because the successes are often invisible. It's sometimes easy to overlook the results of prevention efforts. If they're working, we just live a little longer and a whole lot better.
You may have heard warnings about eating fruits and vegetables that may have pesticide residues. Experts say, however, that the benefits from eating plenty of fruits and vegetables far outweigh any risks. They recommend, though, that you wash your produce thoroughly and enjoy. Now, here's another issue.
A newborn cries. A healthy child comes into the world. This miracle of life doesn't simply happen by chance. From the time of conception to the moment of delivery, what the mother does during this prenatal period can determine how healthy her child will be, and even if it lives or dies. Each year, about 4 million babies are born in the United States. About 35,000 of them will not live until their first birthday, and around 150,000 will be born with birth defects like spina bifida, AIDS, and fetal alcohol syndrome. Nearly 250,000 babies will be born to women who receive late or no prenatal care during pregnancy. These babies are about 3 times more likely to die before their first birthday.
Prenatal care is the process that a pregnant woman goes through of maintaining contact with her doctor or midwife throughout the pregnancy. And there's a medical component that's important for identifying complications early so that they can be treated or ideally prevented. Prenatal care has an important role in making sure that the baby is born healthy by screening or testing for complications that can arise.
Although more women across all ethnic groups are seeking earlier prenatal care, there are still substantial racial and ethnic disparities. Unfortunately, those disparities are sadly reflected in higher infant mortality for people at the lower end of the socioeconomic scale. The public health challenge is to raise the awareness of the need for prenatal care throughout the entire population, to lower the barriers, and to make those services readily available to people who have limited means.
There are many things that a woman can do to prevent complications during her pregnancy and to enhance the development, the healthy development of her baby. The first thing we believe in is, of course, regular prenatal care, coming for care on a regular basis so that she can learn about her body and about the changes and about her developing baby. We encourage women to eat properly, to eliminate all drugs and alcohol, and to watch for early danger signs that we teach them about that could lead to further complications.
This year, nearly 750,000 babies will be born to women who have used one or more illicit drugs during pregnancy. These babies are twice as likely to be of low birth weight than if the mother had refrained from drugs. Proper prenatal care can help guide a woman with her diet and exercise so that she reaches the proper weight to optimize her baby's development. For all women in their childbearing years, a nutritious diet with a daily consumption of 0.4 milligrams of folic acid is recommended because it's necessary for the child's development.
I really hope that in this country and around the world that women will soon have somebody in their neighborhood who, from as soon as they think they might be pregnant, they have no difficulty getting an appointment, that they're seen by somebody who cares about them, who has the technical expertise that they need, and who can provide them with sensitive care throughout their pregnancy.
Darwin launched the theory of survival of the fittest, and there is no other time this theory is more true than at birth. Proper prenatal care is essential to ensure that the children we bring into the world are as fit as possible so that they can survive and thrive.
Vaccinations, a powerful weapon in the war against deadly childhood diseases. Why are they so important? Who needs them? When should they be given? Get all the information when we return on Today's Health.
If you're concerned about getting high blood pressure, start exercising. An aerobic workout several times a week can help reduce your risk of high blood pressure. It may even prevent a heart attack. So run for your life after you watch this.
An innocent newborn, so cute, so cuddly, so vulnerable. Viruses like polio, pertussis, measles, and diphtheria can mercilessly invade a child's system and steal a young life in its infancy. Fortunately, that doesn't happen much anymore. We now vaccinate children against many diseases that can kill or leave a child permanently disabled. But a vaccine only works if the child gets it in time.
There are many reasons why parents are unable to get their children vaccinated. Some of them are financial. They don't have adequate numbers of providers in areas where they live. And also, they may not seek medical care during a time that the child is healthy.
Vaccines, or immunizations as they are often called, are a means of protecting a child or an adult from a disease without the child or the adult actually getting the illness.
Since vaccines were introduced, the incidence of diphtheria, measles, mumps, pertussis, polio, rubella, and tetanus have all dropped nearly 99% in the U.S. But even with statistics like these, some parents are not vaccinating their children.
We start vaccinations when the child is born. So really within the first 2 days of life, they receive their first vaccination. The other immunizations start at age 2 months. Those are for diphtheria, whooping cough, tetanus, polio, and something called Haemophilus influenza type B. Right now, the Centers for Disease Control and the American Academy of Pediatrics are giving physicians a choice as to how they immunize against polio. They can either use the standard oral polio vaccine or another regimen starting with 2 doses of the killed vaccine, followed then at a year of age with a dose of the oral vaccine.
Statistical data shows that less than half of all children in the U.S. are up to date for their primary immunization series. The current public health challenge is to help raise that figure to 90%. While government agencies pay for about 60% of vaccination programs, costs can still be a factor. Public health organizations in many communities are now sponsoring outreach services to raise awareness and deliver proper immunizations, especially in medically underserved areas.
What we have is a pediatric mobile clinic. Our focus is a much more comprehensive focus. We are focusing on comprehensive well child care and also acute care.
Legislation requires that children be adequately vaccinated by kindergarten, about age 5.
So what you're going to see over the future is a number of new vaccines coming down the road. In addition, there's much research going on combining vaccines.
If we lose just one child to a vaccine-preventable disease, that's one too many. The most important thing parents can do for their children is to see that they receive a complete set of vaccinations. It can help give them a lifetime of good health.
Raising children is an art, not a science, but one thing is clear. Building children's self-esteem is vital to their development. Psychologists say that parents who reinforce the positive and don't dwell on the negative help their children grow into emotionally strong adults. Here's another positive solution.
It's an alarming statistic. Childhood injuries kill more children every year than all childhood diseases combined. These are unthinkable tragedies no one ever thinks will happen, but they do.
Every year, about 22 million intentional and unintentional childhood injuries occur in the United States. With successful vaccination programs and modern medicine, children are no longer dying of the childhood diseases that threaten their grandparents. But injuries due to everything from violence to skateboards are still taking a deadly toll. And that's why public health organizations are now focusing efforts on injury prevention.
The first common injury that we see are injuries that children sustain from automobile crashes. The second most important are kids that are burned. Then we see children that fall. We have children that unfortunately drown. And then we have children that take poisons and substances that they have access to.
Public health officials are studying injuries of all types, from domestic violence and drug-related shootings to car wrecks and inline skating accidents. Their goal is to understand how and why the injuries are happening, and then design strategies to help prevent them from occurring in the future. There are many outreach efforts by federal, state, local, and private organizations to help make a child's life a little safer.
Every day in our communities, kids are killed by automobiles, and nobody stands up and gets angry about it. They accept it as a normal, common, everyday occurrence, and many people treat this as an accident, as an act of God, and that is clearly not the case. It is not an act of God. The fact is that we know what the patterns of injury are. We know what causes these injuries, and we know how to prevent them. As an example, today you could go out and make sure that your infant is in an infant seat in the proper position in your automobile. When that crash occurs, and guaranteed that that crash is going to occur to your family, that child's going to be protected. One thing you could do with a child on a bicycle is put a helmet on that child's head. We know that it protects these kids. It prevents 90% of the injuries to the brain. And the most disappointing thing for families today is that a child sustains a brain injury and there's nothing American medicine can do about it today.
There's nothing on earth more precious or innocent than a child. And every young life holds the promise and potential to change the world for the better.
Public health efforts can help create effective prevention, intervention, raise awareness, and hopefully inspire all of us to take the precautions necessary to prevent injuries and save young lives.
Sex, drugs, and alcohol. Tough decisions for adults. For teens, the temptations can be overwhelming and the results can affect them for the rest of their lives. What are public health organizations doing to help us make healthier choices? Coming up next.
Emergencies occur when you least expect them. One way to prepare for the unexpected is to learn CPR. Many communities and organizations offer free courses. Knowing CPR could help you save a life. This next feature focuses on another important health issue.
From the time we reach our adolescent years until the day we die, all of us are confronted with decisions about cigarettes, drugs, alcohol, and sex that can have a major impact on the quality of our life or even whether we live or die.
It's tough enough when you're an adult to make healthy choices about all these options. Unfortunately, those decisions don't wait until you're 21.
It is obvious that teenagers are confronted with many of the same difficult choices that confront adults. Only in general, they're less mature, more susceptible to peer pressure, and simply not adequately prepared to make the right decisions. The challenge to public health is to help those teens make better decisions today that will maximize their options tomorrow.
Making healthy choices now are critical in the teen years because so many things are formative in that period. For example, we know that young adults has a very high HIV/AIDS rate, that's a category that's now showing up more of young people in their 20s. Well, obviously, those choices were being made in their teens. So young people may be making choices, whether it's choices around sex or smoking or drugs or becoming a parent. All of those choices, obviously, made as a teenager are going to have tremendous impact on their health status as they move into adulthood. But they're not thinking future adulthood. They're thinking today, tonight, and tomorrow. First of all, reaching out to teens is in fact a priority. And that secondly, you have to be creative, innovative, and often interactive in those strategies.
Previous efforts made by public health agencies and private organizations have been successful in encouraging all Americans to adopt healthier choices. In 1960, 40% of adults smoked cigarettes. Now smokers total only about 25%. Alcohol-related automobile injuries have decreased since that issue has come into focus. From public health campaigns and independent organizations.
The parent's not always going to be right there. The young person is going to constantly, as they move into young adulthood, be confronted with difficult choices. I think the best thing that the parent can do is create an open environment in their household to support the young person in whatever decision they're making.
Unfortunate decisions made during early adolescence and teen years can permanently affect a young life and sometimes end it.
It's not easy being young. Adult choices confront teens, but they often lack the experience and maturity necessary to deal with them. Public health agencies can help, but young people need strong direction and support from parents, teachers, and other concerned adults who practice what they preach.
When it comes to health issues, there's so much to discuss and so little time to cover it all. If you want more information about any topic you see on the show, browse over to our website at www.vstar.com and we'll hotlink you right to the source. In times of stress, many people reach for the bottle to help themselves cope. Unfortunately, alcohol often compounds problems rather than helping to solve them. A better idea is exercise. A few sit-ups or a long run may help you cope a lot better than a few drinks. Here's more.
Turn on the evening news on any given night, and it's clear that America is in the midst of one of the deadliest outbreaks known to man, an epidemic of violence.
Anybody here ever seen anyone shot?
And the man just started shooting them and shooting. People were just running. And we were just, me and my brother and sister, we were just shut in shock. We were just looking out our windows like watching the man get shot.
Why then, young people, are we so violent and respond so quickly? And I want anybody to talk to me about this now.
Violence has infected our society, and it's killing and injuring Americans at an alarming rate. Suicide is now the 9th leading cause of death among the population, and homicide is 10th. Together they account for over 50,000 deaths each year.
Among young people ages 15 to 24, homicide is the second leading killer.
And we work with young people all the time who are not sure they're going to live through their 20s, and they're not sure they're going to live without being harmed by gunshots.
Well, my brother got shot when he was walking down the street.
No one know why?
Experts in sociology, psychology, and criminology, among others, have come together to set a framework for community action.
I mean, you should have like 1 or 2 people in your life where you can tell anything to.
I like that.
And I think your parents should be them 1 or 2 people.
Yes, I think it's very critical that support starts at home, that families teach their children about prevention, about violence, that the subject is not one that's not discussed.
Each year, suicide deaths outpace homicides, and the groups with the highest suicide rates are young people 15 to 24 years old and the elderly, especially men. And educational efforts can help boost awareness of help and counseling available and publicize the warning signs for those at risk.
And I think, young people, it's about choices and about decision making. So we got to make good decisions.
Whether it's a complex virus or deadly violence, if it threatens the health of the public, it's a challenge to be dealt with by public health. The efforts of public health agencies affect all of us all the time. They're helping all of us live longer by seeking to prevent life's biggest risks.
Whether you live life in the fast lane or on a country road, when you don't feel well, all the things you work so hard for don't seem quite so wonderful. If you take proper steps to avoid health risks and stay well, you may be able to get more out of life and even enjoy it better. I'm Faith Daniels. For more information about any of the stories that we've featured on the show, log on to our internet website at www.vstar.com and join us next time as we get right to the heart of matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.